Perfect, Dyer. Let's focus on the gross anatomy of the heart. In full graduate level depth, clear, systematic, and clinically relevant. This will cover all major features, position, surfaces, chambers, valves, vessels, pericardium, and relations. Below is your complete AZ summary, ready for postgraduate level understanding. Gross anatomy of the heart, graduate level 1. Location and orientation. The heart lies in the middle mediastinum, within the pericardial sac, positioned obliquely, 2/3 left and 1/3 right of the midline. Extends from 2nd to 5th intercostal space. The apex points inferolaterally to the left, at the 5th intercostal space, mid-clavicular line. The base faces posteriorly, toward the vertebral column. R. Surfaces of the heart. Surface formed by key. Relations sternocostal. Anterior. Mainly right ventricle. Small part of right atrium and left ventricle. Behind sternum and costal cartilages. Diaphragmatic. Inferior. Both ventricles, mainly left, rests on central tendon of diaphragm. Right. Pulmonary right atrium faces. Right, lung. Left, pulmonary left. Ventricle faces, left, lung. San, borders of the heart. Border structures. Right border right atrium, extending between SVC and IVC. Inferior border right ventricle and small part of left ventricle. Left border left ventricle and left auricle. Superior border atria and great vessels. Aorta, pulmonary trunk. SVC. Chambers. Right atrium receives deoxygenated blood from SVC, IVC, and coronary sinus. Internal features. Sinus venarum. Smooth posterior wall. Crista terminalis. Ridge separating smooth and rough walls. Auricle. Muscular appendage with pectinate muscles. Fossa ovalis. Remnant of fetal foramen, ovale. Right ventricle. Receives blood from right atrium via tricuspid valve. Structures. Trabeculi carnii. Muscular ridges. Moderator band. Septomarginal trabecula. Carries right bundle branch. Infundibulum. Conus arteriosus. Smooth outflow to pulmonary. Trunk pulmonary valve. 3 semilunar cusps at outflow tract. Left atrium forms most of the base of the heart. Receives oxygenated blood from 4 pulmonary veins. Smooth interior except for auricle, with pectinate muscles. Left ventricle forms apex, and most of diaphragmatic, and left surfaces. Wall is 3x thicker than right ventricle. Structures. Trabeculae carneae, more delicate than right. 2 papillary muscles. Anterior, posterior, aortic vestibule. Smooth outflow tract to aortic valve. Aortic valve. 3 semilunar cusps. Woo. Valves of the heart. Valve leaflets. Divided by cusps location function tricuspid. Right AV3. Between RA, RV prevents backflow during systole pulmonary 3 semilunar RV. Pulmonary trunk prevents reflux during diastole. Mitral. Left AV2 between LALV prevents regurgitation during systole aortic T. Semilunar. LV aorta prevents reflux during diastole. Lu. Great vessels aorta. Ascending arch, descending pulmonary trunk. Divides into right and left pulmonary arteries. Venae cavae. Drain into right atrium. Pulmonary veins. 4. Drain into left atrium. C. Pericardium. Fibrous layer. Tough outer layer fused with diaphragm's central tendon. Serous layer. Parietal layer lining fibrous sac. Visceral layer. Epicardium. Covering heart surface. Pericardial cavity. Thin film of serous fluid between layers. Sinuses of pericardium transverse sinus. Between outflow aorta divided by pulmonary trunk and inflow tracts. Oblique sinus. Posterior to left atrium between pulmonary veins. Coronary circulation. Gross overview. Right coronary artery, RCA, supplies RA, RV, SA node, 60%, AV node, 80%. Left coronary artery, LCA, divides into anterior interventricular, LAD, LV anterior wall plus septum circumflex, LV lateral and posterior walls. Venous drainage via coronary sinus, right atrium. Sure. Conduction pathway, overview. Synode of node bundle of his right. Left bundle branches Purkinje fibers. Located strategically in right atrial wall and interventricular septum. She. Clinical correlations. Right dominance, 285%. RCA gives posterior descending artery. Left dominance, 210-15%. PDA from circumflex branch. Surface landmarks. Apex beat. Synthesis. Left midclavicular line. Valve auscultation points. Aortic. Zweind right ICS pulmonary. Zweind left ICS tricuspid. Vierth geteilt durch fünft left Sternalborde mitral. Fünft ICS midclavicular line. Clinical tip. Remember. Raw. Thin. Wall. Receives systemic blood. RV crescent. Shaped in section LV circular. Thick wall. High pressure system.